Hi, welcome. My name's Jane. So for my health talk today, I'm going to talk to you about osteoporosis. Now, you might have heard of osteoporosis and you might know what it is. It basically means porous bones, or you might have heard it being called brittle bones. Basically, it means the bones in our body have holes, so they're not going to be as strong, so they'll break easily. 3 million people in the UK are thought to have osteoporosis. There are 230,000 fractures a year. And this can actually be life-threatening. There are 89,000 hip fractures a year. 10% of those people will die within the first month. 30% will die within 1 year. Now, obviously, there are lots of other complications and reasons for this, but the majority of breaks come from falling. Even a simple sneeze for someone who has osteoporosis, it can cause a breakage. Osteoporosis is more common in females. 1 out of 2 women and 1 out of 5 men suffer a fracture after the age of 50, mainly due to poor bone health. So osteoporosis was thought to be mainly a woman's disease and an elderly woman's disease, mainly associated therefore with postmenopausal women. However, more recently, men, women, young children even. So commonly people in their 30s and 40s now are being diagnosed with osteoporosis. And the main reasons for this is their diet. There is normally a balance between new bone density being laid down and the normal breakdown and reabsorption of bone. And as we get older in life, this balance changes. And then we start to occur with osteopenia, which is a precursor to osteoporosis. And this is measured with our overall bone mass density, which is measured with the DEXA scan. And the sort of lower your score is, then the more severe your risk of loss of bone mass, and then fractures will occur, etc. So what is the treatment? Medication or an injection to inhibit osteoclasts, which are responsible for breaking down old bone. So we're trying to slow down the breakage of bone, which happens naturally with old age. You can have hormone replacement therapy, and you can reduce some of the lifestyle factors that affect bone density. For example, smoking. So if you smoke, you really need to stop. That can affect your bone density. We also need to consume sufficient amounts of calcium and vitamin D and perform appropriate exercises. How can we prevent this then? Well, we can prevent osteoporosis by looking after ourselves, by consuming a diet adequate in calcium, and by exercising early in life so we maximize bone density. As unfortunately, as we get older, it starts to decline for everyone. Unfortunately, we have our dairy is a very limited amount of calcium. Hence, we really need to encourage ourselves to eat green leafy vegetables as well. And exercise is important for the prevention and management of osteoporosis. It helps to increase our muscle strength as well as improving our balance, and all those things contribute to risks of falls, which therefore, if you have osteoporosis, you're more likely to get a break. So we need to eat healthily, exercise healthily. If you want to know more about how you can do that, or you want to join any of my programs or classes, send me a message. Otherwise, enjoy the rest of today. Happy International Women's Day. Thanks for watching.